you're here for your booking an appointment, is that right? Yeah. So, my name is Nurse Tinker, and I'm one of the community midwives for your area. Lovely to meet you. Can you remind me what your name is? Okay. Okay, let me just check. Just get it correct on your file. Okay, so that was, yeah, okay. And is this your partner, your friend? Okay, yeah. Okay. Yeah, sure. Right. So, time to find out a bit about what's going on. So, how long ago did you get a positive pregnancy test? Yeah. Yes. And do you know what the date was of your last period? Okay. Yeah. Okay, yes, not a problem. So do you know your possible ovulation date? Okay, yeah, we can work that out. Okie dokie. Have you been pregnant before, or do you have any other children? Okay. Yeah, sure. Yeah. Yeah, everybody's different. Lots of people go through lots of different things, and it's not always positive, so I can completely understand that things might have been a bit difficult. Okay. Yeah, do you want to tell me a little bit more about it? Yeah, that's okay. And we do offer a counselling service, if that would be helpful for you. I do have the numbers in the file here for you that you can take away with you today. Okay, yeah, sure. So, can you tell me a little bit about your symptoms so far? What have you been experiencing? Okay, so some nausea. Yeah, some cramps. Any bleeding at all? Yeah, a little bit can be normal. There's lots of things going on in our bodies at that point, so that can be absolutely normal and nothing to worry about. Apologies, there's a plane going over, but I think it's on its way. But yes, yeah, don't worry about that yet. But what I would say is, if you have any heavy, consistent bleeding, which continues for a long amount of time, or is really bright red in colour, and seems to be kind of heavy, then I would get you to call the clinic immediately, and they'll book you in for an appointment to check out what's going on. Yeah, not a problem. Any worries, give them a call. The number is here on your file, so don't worry. Okay, so tell me a bit about your nausea. How bad has it been? Okay, and what have you been doing to help? Has anything helped, or? Okay, yeah. Medication from your doctor may help. Some people experience quite intense nausea called hyperemesis gravidarum, if I've pronounced it correctly, and this means that people are not able to keep down the correct nutrients and things, and it can be quite difficult. So just watch how much you're able to keep down at the moment, and if you feel like you might be getting dehydrated or not being able to keep any food down at all, give your doctor a call immediately. Okay, so at the moment sounds alright. Yeah, it's not very nice, is it? Not a problem. So, what I want to find out mostly at this appointment is a bit about your family history, a bit about your partners, the parent of the child, and a bit about their background, so that we can work out if there are any possibilities for any difficulties from either side, or anything hereditary that we need to keep an eye on. Okay, so do you or your partner have any history of diabetes? Anyone else in the family? Okay, yeah. And how about any conditions such as cerebral palsy, or any sort of birth difficulties? Yeah. Okay, yeah, even if it's sort of distantly related, it might all be relevant. Okay. Yeah. Does anyone in your families have autism or any learning disabilities at all? Yeah. No, not to worry. Try not to concentrate on things that you think might go wrong. At the moment, we're just taking a full history so that we can be aware of anything that might happen. And do either of you have any iron deficiencies or anything like that? Or have had in the past? Okay, yep, sure. Okay. Yep, not a problem. Okay, and any other conditions that either of you have in your family, sort of like rheumatoid arthritis or anything like that that I should be aware of? Okay, yeah. Yeah, every bit of information is helpful, thank you. Yeah. Okay. Good. Okay, right, so what will happen next after this appointment, I will get your booking in for your 12-week scan, where we'll be able to tell if things are progressing, okay, and hopefully you'll be able to see your little baby at that point. So that will be in a few weeks' time. You will get a letter through the post and it will tell you what the date is. And then after that, if that all goes well, then what I need you to do is book in an appointment with the community midwives for week 16. So that's the next time you will see me or one of the other midwives on the team. And I've got all the information here. You have this file to take away with you today. And in here it has just information as to when your next appointments will be, and any information about self-referral for counselling or anything like that. And it has some pieces of information about appointments and what you're likely to expect. There's some information there about baby feeding and parenting, and there's also lots of information online as well on our NHS maternity pages, so you can have a look at that as well. I'm also giving you this package here, which has got some extra tablets in there. There is a pen, just some little leaflets about pregnancy and what to expect. And also what I need you to do is, within the next couple of weeks, I need you to book an appointment with your doctor for your pregnancy bloods, or with a nurse more likely. And what they will do is they'll take your full blood count to check how things are progressing, if there's any problems, if your iron is low, things like that. They're just checking that things are where they should be at this point, and that your HCG levels are at the right place compared to where the growth of baby should be. Also, what I need you to do, I know these are always a bit embarrassing, but I need you to do a urine sample and take that in as well, and they will just check that there's nothing untoward going on in your urine as well. But that normally all comes back okay, so it's nothing to worry about. The reason we do that is so that we can check whether there are any infections or anything going on like that that needs sort of treatment earlier rather than later. It's always best to get on top of these things when you're pregnant and not leave any infections going too long. That was another question I was going to ask you for your notes, and that is, do you have recurrent or often have urinary tract infections? Okay, yeah. Yeah, no problem. So what I will do is I will put you on the pathway. That means that they will take a closer look at that area for you. That means that I will provide you with a number of these bottles, and what I would like you to do is to give one in to your surgery once a month so they can keep track and see whether you're having any infections, and the sooner they treat them the better. So it's really good to keep on top of that as well. Yes, of course, it does feel like quite a wait until the first scan, but you do have other options and it is completely up to you. There is the possibility that you could have a private scan, and this is not something that the NHS obviously offers, but for peace of mind, a lot of parents do have an early scan to check that things are going well. And what you will need to do to be able to sign up for that, there are a number of companies who offer private scans. Usually the cost of a one-off private scan is about £70 to £80, but in that scan you will get reassurance whether things are going well, or if there's anything to worry about, and they will be in contact with the NHS services to provide any ongoing care. So for example, there is a company who do first scans, and there is a leaflet in here with some information on that if that's something that you would like to book. And some of the nice things about having a private scan is you can see it in a much more calm environment than NHS kind of environment, plus also you get to do a scan a little bit earlier than you would. So for example, the first scans that the NHS offer are between 12 and 14 weeks. Now with a private scan you can have one quite early, so for example you could have one at 8 weeks to see how progress is getting along, and that is really helpful for some parents for peace of mind, to know that things are going well. And if you've had any problems in the past, they will give you as part of the scan an obstetrics report, which will have information on it, such as whether it will include information about the yolk sac, that the embryo is there, that there's a heartbeat. That's one of the most important things that they will be looking out for on these scans, is that the embryo has a heartbeat. And they will look to see that things are forming correctly at that point, and you'll be able to see it on a big screen, and you may be able to take a video away with you. That's something the NHS doesn't offer, so you can always go ahead and do that, but it's completely up to you. I mean, there is a cost involved, but it can be helpful for peace of mind, like I said, to be able to do that. They can also check how many fetuses are present. So some people have twins or more, and at this scan they can see into the uterus and see how many embryos are sitting there, and then they can give you information about how they're developing and give you more information going forward and advise you on what to do next. So I'm just going to do a few of your vitals next, and that should be the conclusion of our appointment. Something I would suggest if you're finding nausea really bad, one thing you can try are seasickness travel bans. They can be very useful. They basically just use a very holistic approach to pressing on pressure points on your wrists, which will sometimes in some people helps to reduce nausea effects, and some people wear them all the time because they find they really work. So that's just another idea I had for you. Also, another suggestion is that when you've got that horrible taste in your mouth and you're finding it really hard to just get through the nausea, so you have a mint or gingins, like ginger sweets. They can be quite helpful as well. Also drinking fizzy carbonated water, that can be really helpful. It helps to get the bubbles up. But yes, just do keep an eye on if it gets too bad to see your doctor, and they can prescribe some medications which may help. They're called antiemetics, which may help to reduce your nausea symptoms, but they don't work for everyone, so just bear that in mind. Okay, I'm going to do a couple of your vitals now. I just want to check that your responses are good and check your heart rate. Just going to have a little look in your eyes, just to check there's nothing going on there. Okay. Alright, if you just want to look at the flower behind me, I'm just going to have a look in your eyes. If you can look up to the ceiling for me. That's it, good. Okay, good. Well done. Looks okay to me there. Let's have a look at your other eye. Let's have a little look. Okay. Anything going on there? No. Alright. Okay, if you can look up for me. Yeah. And if you can look down, I'll look in both of your eyes. Good. Okay, and the other one. Okay, if you could just follow the light for me. Good. Alright. That's it. And that one. Good. Great. Good. Are you suffering with any headaches at all at the moment? Okay, just bear in mind you won't be able to take your normal medication to take for migraines or headaches or anything. And where you can, you need to try and find ways to calm the headache down without taking them. Just try and drink lots of water, rest it out, dark room, just rest as much as you can. Okay, good. I'm going to have a very quick look in your ears. There shouldn't be anything to worry about there, but might as well whilst we're at it. Okay. That all looks okay. Yep. And this one. Alright. Good, lovely, that looks fine. Okay. Now I just want to check your heartbeat and your pulse just to see. So, during pregnancy, your body's blood will increase. The quantity within your body will increase quite a lot. So it can at least double, possibly quadruple the volume of blood within your body during this time. So you need to be aware of fainting spells because your body is trying to process so much more blood. It's really, really hard work for it. And also just try and be aware of the fact that you might hear your blood rushing sometimes. That's completely normal. Your body is trying to deal with this increased load, and it's hard. At the moment, your baby's heart rate is about double the speed of your own, which is really interesting. Yeah, so we need to just keep an eye on blood pressure, iron levels, things like that, because that's a very important area of focus to make sure things going okay. Okay. Right. I'm just going to place this on your chest. Okay. And we'll just see how your heart rate is doing. Okay. Okay, take a deep breath in for me. Okay, I'm just going to pop it down your back of your shirt, okay? has triggered some women to find out that they're pregnant, because the heart rate does differ slightly, the average top rate. So yes, so that's all, nothing to worry about at the moment, but if you do have any concerns, please give us a call. And for the moment, what's most important is you stay relaxed. If things get too much with your nausea, take some time off or get signed off from work to have enough time to relax and recover, because doing too much is the worst thing you could do at the moment. So just take it easy, and everything that you need for now is all in your file. And what you need to do is you need to take this file with you to every appointment that you go to, because they will put more information in you. There is a special piece, which means they can attach more information to the file as time goes on. So that's very important for you to have with you at every appointment. Now, at the 12-week scan, they will offer you some tests. One for Down syndrome. They can do a test to find out whether you're at risk of your baby having Down syndrome, and also for Edward syndrome. And it's completely up to you whether you have these tests or not. It is completely your choice, but there is more information in your file, in your pack, to tell you about these and whether you want to have the tests or not. They're purely to give you more information, to advise you on what to do if you are higher at risk. You can have further tests to find out whether your baby does have this, or you could choose not to have the tests and just carry on with the pregnancy. Some people find it less stressful not knowing that they might be more at risk. So it's your choice at the end of the day, and so that's something to think about whilst you're waiting for that next scan. So I do hope that in the meantime you rest well, and just try and keep a good balanced diet at the moment, and make sure to take extra folic acid. If you speak to your doctor, he can get you a prescription for that if needs be, and also any prenatal or vitamins. Pregnant care is a good one, and there is some free pregnant care tablets in your pack, and you need to take these ideally every day, because your body needs these extra vitamins at the moment. Okay, so it was lovely to see you today, and I hope things go well, and I hope to see you soon. Okay, take care and rest well.